Hey everyone, and welcome back to the channel. Today we're taking a really important look at something that affects all of us, whether we realize it or not: public health dentistry. Specifically, welcome to our deep dive into the essential tools of public health dentistry. Today, we'll explore the various categories of tools that help promote oral health and prevent dental diseases at the community level. Think of these tools as the specialized equipment and strategies that dental professionals use not just to treat individual patients, but to uplift the oral health of entire populations. It's about prevention, education, and ensuring everyone has a fair shot at a healthy smile. Why is this so crucial? Well, oral health is intrinsically linked to overall health. Issues in your mouth can impact your heart, your digestion, and even your mental well-being. Public health dentistry aims to tackle these challenges on a grand scale, addressing disparities and creating healthier communities from the ground up. It's a proactive approach, rather than just a reactive one. Throughout this video, we'll be breaking down these tools into distinct categories, showing you exactly how they work and why they are so vital in the fight against dental diseases. So grab your thinking caps, maybe a glass of water. Stay hydrated, folks, because we're about to explore everything from how we measure oral health in large groups to the educational materials that empower individuals and the policies that shape dental care for all. We'll cover epidemiological tools, preventive measures, health education strategies, administrative frameworks, community interventions, and the research that drives it all forward. By the end, you'll have a much clearer picture of the multifaceted world of public health dentistry and the incredible impact it has. Let's get into it. All right, first up, let's talk about epidemiological tools. Now, epidemiology might sound like a complex word, and it is a sophisticated field, but at its core, it's about studying patterns, causes, and effects of health and disease conditions in defined populations. So in public health dentistry, these tools are our eyes and ears on the ground, helping us understand the current state of oral health across communities. We need to know where the problems are, who is most affected, and what trends are emerging. This isn't just about individual checkups. It's about painting a broad picture of a population's dental well-being, which is absolutely foundational for planning any effective intervention. One of the cornerstones here are dental indices. You might have heard of some, like the DMFT index, which stands for decayed, missing, and filled teeth. This simple yet powerful tool gives us a numerical score that reflects a person's lifetime experience with dental caries or cavities. Then there's the CPITN, the Community Periodontal Index of Treatment Needs, which helps us assess gum health and the need for periodontal care in a population. Alongside these indices, we rely heavily on surveys and screening programs. These are designed to collect data systematically from representative samples of the population, giving us valuable insights into prevalence rates, risk factors, and access to care. These aren't just random checks. They are carefully structured investigations. And of course, all this data needs to be processed and understood. That's where statistical analysis tools come in. Software like SPSS, or Statistical Package for the Social Sciences, or EPI Info, which is specifically designed for public health professionals, allows us to crunch the numbers, identify significant patterns, and test hypotheses. Think of it as the engine that turns raw data into actionable intelligence. Finally, we have disease surveillance systems. These are ongoing, systematic collections, analyses, and interpretations of health-related data essential to planning, implementing, and evaluating public health practice. They act like an early warning system, alerting us to outbreaks or rising trends in dental diseases, so we can respond swiftly and effectively. Now that we've seen how we assess the situation, let's move on to how we actively build defenses against dental diseases. This brings us to our second category, preventive tools. As the name suggests, these are all about stopping problems before they even start, or at least catching them in their very early stages. In public health, prevention is always better and usually more cost-effective than cure. We're talking about interventions that can benefit large numbers of people, reducing the overall burden of dental diseases like cavities and gum disease within a community. It's about creating an environment where good oral health is easier to achieve and maintain for everyone. A major player in prevention is fluoridation. Fluoride is a naturally occurring mineral that strengthens tooth enamel, making it more resistant to acid attacks from bacteria that cause cavities. We see this applied through community water fluoridation, which is often hailed as one of the top public health achievements of the 20th century. But it doesn't stop there. There are also programs for fluoridated salt or milk in some regions. Another key tool, especially for kids, is pit and fissure sealants. These are thin plastic coatings applied to the chewing surfaces of the back teeth, the molars and premolars, where most cavities in children occur. They act as a physical barrier, sealing out food and bacteria. Then we have the more hands-on preventive measures. Oral prophylaxis equipment, which includes tools for professional teeth cleaning by dentists or hygienists, helps remove plaque and tartar buildup that regular brushing might miss. Topical fluoride application kits allow for concentrated fluoride treatments to be applied directly to the teeth, offering an extra boost of protection, especially for individuals at higher risk. And of course, we can't forget the basics. Toothbrushes, especially when used with fluoridated toothpaste. Promoting access to and correct use of these fundamental tools is a huge part of community-level prevention. It's about empowering individuals with the means to protect their own oral health daily. Knowing how to prevent disease is one thing, but ensuring that knowledge reaches the people who need it and inspires them to act is a whole other challenge. That's where our third category, health education tools, comes into play. These tools are all about communication, effectively conveying information about oral health, promoting healthy behaviors, and empowering individuals and communities to make informed decisions about their dental care. It's not just about telling people to brush their teeth. It's about explaining the why, the how, and making it relevant to their lives. This is crucial because many dental diseases are largely preventable through good habits. We use a wide variety of materials to get the message across. Traditional tools like posters, leaflets, and brochures are still incredibly effective, especially in community settings like clinics, schools, or community centers. They can provide concise, easy-to-understand information on topics like proper brushing techniques, the importance of diet, or the risks of tobacco use. Models of teeth and jaws are also fantastic visual aids. They allow dental professionals to demonstrate concepts in a tangible way, making it easier for people to visualize what's happening inside their mouths and understand the impact of different habits or conditions. Seeing a model of how a cavity progresses can be much more impactful than just reading about it. But health education has also evolved with technology. Audio-visual aids like videos, much like this one, animations and presentations can engage audiences in dynamic ways. And now, we have interactive tools like mobile apps and educational games that can make learning about oral health fun and engaging, particularly for younger audiences. Think about an app that reminds you to brush or a game that teaches kids about healthy food choices for their teeth. Beyond these materials, school dental health programs are a cornerstone of health education, reaching children at an early age to instill lifelong healthy habits. These comprehensive programs often combine education with screenings and preventive services. Chapter 4. The Blueprint, Administrative and Policy Tools. So we've talked about understanding the problem, preventing it, and educating people. But how do we organize all these efforts on a larger scale? This is where administrative and policy tools become absolutely essential. These are the frameworks, guidelines, and systems that public health professionals use to plan, implement, monitor, and evaluate dental public health programs effectively and efficiently. Think of them as the strategic backbone that ensures our efforts are targeted, sustainable, and make the best use of available resources. Without these, even the best intentions can fall short of making a real community-wide impact. At the highest level, we have health policy documents. These can be national, regional, or local policies that outline the goals, priorities, and strategies for improving oral health. They might address issues like funding for dental services, regulations for water fluoridation, or standards for dental care in schools. Program planning frameworks like the well-known Proceed model provide a structured approach to designing health promotion programs. This model, for example, guides planners through a series of steps, from social assessment and epidemiological diagnosis to policy and intervention development, and finally, evaluation. It helps ensure that programs are evidence-based and address the specific needs of the target population. Then there are tools for managing the practicalities. Cost-effectiveness analysis tools help decision-makers compare different interventions to see which ones provide the greatest health benefit for the resources invested. This is crucial when budgets are limited. Monitoring and evaluation checklists and systems are vital for tracking progress, identifying challenges, and making necessary adjustments to programs along the way. We need to know if what we're doing is actually working and how we can improve. And underpinning much of this are health information systems, which are used to collect, store, manage, and analyze data related to oral health services and population health status, feeding back into the planning and policy cycle. Chapter 5. Reaching Out. Community-based interventions. Now, let's talk about taking dental health directly to the people. This is where community-based interventions come in. These are practical, on-the-ground strategies and tools designed to reach populations where they live, work, and learn, especially those who might face barriers to accessing traditional dental care in a clinic setting. The goal here is to make prevention, education, and basic care more accessible and equitable. It's about breaking down geographical, financial, or cultural barriers to ensure that everyone has the opportunity to achieve good oral health. This proactive outreach is fundamental to public health dentistry. One of the most visible examples of community-based interventions is mobile dental vans or clinics. These are essentially dental offices on wheels, equipped to provide a range of services, from screenings and cleanings to fillings and sometimes even extractions in underserved rural or urban areas. They can travel to schools, community centers, or remote villages, bringing care directly to those who need it most. Community outreach camps are another powerful tool. These temporary setups, often organized by dental schools, NGOs, or public health departments, can provide intensive services and education to a large number of people over a short period, often in areas with limited permanent dental facilities. Within specific community settings, like schools, we use tools like school dental checkup kits. These kits contain the basic instruments and supplies needed for dental professionals or trained health workers to conduct oral health screenings for children, identify potential problems early, and refer them for further care. For interventions like community water fluoridation, which we discussed earlier as a preventive tool, there are also community water fluoridation testing kits. These allow for regular monitoring of fluoride levels in the public water supply to ensure they are within the optimal range for dental health benefits, demonstrating how different tool categories often work hand in hand. Chapter 6. Advancing Knowledge, Research Tools. Finally, but certainly not least, we come to research tools. None of the progress we make in public health dentistry would be possible without a continuous commitment to research and inquiry. These tools are essential for assessing needs more deeply, developing new interventions, evaluating the effectiveness and outcomes of existing programs, and constantly seeking ways to improve our practices. Research is the engine that drives innovation and ensures that our efforts are evidence-based and impactful. It's how we learn what works, for whom, and under what circumstances, allowing us to refine our strategies continually. Key tools in the researcher's toolkit include questionnaires and interview guides. These are carefully designed instruments used to collect data directly from individuals or groups about their oral health knowledge, attitudes, behaviors, experiences, and needs. Developing good questionnaires and conducting effective interviews is an art and a science in itself, crucial for gathering valid and reliable information. Once data is collected, biostatistics software, similar to what we mentioned in epidemiological tools but often used here for more in-depth analysis, becomes critical. This software helps researchers analyze complex datasets, identify correlations, determine statistical significance, and draw meaningful conclusions from their findings. Furthermore, public health dentistry research employs a range of qualitative and quantitative research methodologies. Quantitative methods might involve clinical trials to test the efficacy of a new preventive agent or large-scale surveys. Qualitative methods, such as focus groups or in-depth interviews, can provide rich insights into people's perspectives and experiences, helping us understand the why behind the numbers. And underpinning all research activities are ethical guidelines and consent forms. Ensuring that research is conducted ethically, protecting the rights and well-being of participants, and obtaining informed consent are paramount. These ethical frameworks are non-negotiable tools for responsible and credible research. And there you have it, a comprehensive look at the diverse and essential tools of public health dentistry. Thank you for joining us on this journey through the essential tools of public health dentistry. By understanding and utilizing these tools, we can work together to improve oral health at the community level. Don't forget to like, share, and subscribe for more informative content. From understanding disease patterns with epidemiological tools to preventing illness, educating communities, structuring programs with administrative tools, reaching out directly with interventions, and constantly learning through research, each category plays a vital role in the bigger picture of community oral wellness. It's clear that public health dentistry is a dynamic and multifaceted field. It requires a collaborative effort involving dental professionals, policymakers, educators, community leaders, and individuals themselves. The ultimate goal is to create environments and systems that support optimal oral health for everyone, reducing disparities and improving overall quality of life. These tools aren't just abstract concepts, they are actively being used every day to make a tangible difference in people's lives, preventing pain, improving smiles, and contributing to healthier, more productive communities. So I hope this overview has given you a new appreciation for the incredible work being done in public health dentistry and the sophisticated toolkit that professionals in this field utilize. Whether you're a student considering a career in this area, a healthcare professional looking to broaden your understanding, or just someone interested in how we build healthier societies, understanding these tools is key. Let's continue to support and advocate for strong public health initiatives. Thanks for watching, stay curious, and I'll see you in the next video.